the state of Michigan did try, bless their hearts, to engage in a discussion of health disparities and reduction of health disparities. So if you go on the website to the State Department of Health, Wellness, and Disease Control, you'll see a lot of resources and a lot of information. And it's really cool, and you got to know, unless this was updated, was in 2009. Okay? So between 2000 and 2013, there hasn't been any movement here. Now why? Probably reduction in force, consolidation. This got put on hold, wasn't seen as important. So on the one hand, there was an attempt. There's a lot of resources, but they're all somewhat dated. Now, the one piece that really kind of strikes me as very interesting is that on the one hand, we've got a lot of related information about African Americans and about Latinos, okay? And it tends to be on the current side, 2009, 2010, birth study, 2011. So there seems to be a real active, here's the way that health is going for Latinos and for African Americans. When we start talking about Muslim Americans, however, and Arab Americans and Chaldean Americans in Michigan, there is a real disjuncture, okay? And I know that Access has received grants recently to update this, but I was really interested to find out that over and over and over again, the basic access, the basic analysis and presentation of the health issues of Arab, Muslim, and Chaldeans in Michigan comes from this amazing report done in 2001.
Wow.
Okay, and so what is very interesting, and oh yes, a couple of folks say, okay, we've got some information in the state, we're updating it. Well, that was 2 years ago. And love and respect, I got that. But it's like, okay, so where is it? Because that information is kind of needed there in some ways. So this was, I saw something, I got very, very stressed with it because there's a lot of interesting data. But you know what? And there's some background information. Oh, this is nice, this is nice. What's the Muslim, what's the Chaldean? That's helpful. But I think what always kind of stood me for two things. Number one, the sample size of this information was 150. Number two, it was done in 1999, analyzed and published in 2001. And number three, it serves not only in the state of Michigan as the definitive presentation on health disparities in Arab Americans in Michigan, but it's also a national document that is used in talking about the health disparities of Arabs, Muslims, and Chaldeans across the U.S. And they have these amazing charts, and they're the same charts that are used in 2001, even the same percentages. And I said, okay, now that's something that is really very, very wrong. Because this presentation from 150, Arab, American, Chaldean, and Muslim respondents is being used as the end-all, be-all, definitive exploration of health disparities for Arab American, Chaldeans, and Muslims across the entire U.S. And there's something fundamentally wrong with that. Okay? That's a deceit. That's a prevarication. That's a lie. Because we have no idea. Even with Access, bless their hearts, okay? We have no idea what the state of health access and health disparity is for anybody currently in the Arab, Muslim, and Chaldean communities. We don't know. You think it's gotten worse, but we don't know. So it's a really big question mark. But instead of saying we don't know, it's, well, we have this data here. Like, that doesn't like, well, that's ancient. Okay? That's probably no longer accurate either. Okay? So those are some of the challenges. So some of the actions might be to get more recent information. And that's kind of where NBC begins and ends. And it has this action agenda, and I said, oh, goody. I'll share the action agenda with you guys, except that it basically begins with, okay, we got to get more data and better data. Okay? There's some legislation that talks about, at least saying symbolically, that health disparities are inequitable and should not be tolerated. But let's go beyond that. It doesn't go beyond and say, okay, well, that's interesting. So that really is kind of that's the state of the art. Okay, that's the background. A lot of information for African Americans, no solutions, no roadmaps, is to say we should change this. Okay, for Latinos, about the same thing. Very, very little same thing current for Arab Americans. if you have no knowledge about that at all. And the guidance is basically more data, which always leads to action, okay? More data and, policy if you want to. Here's where the work begins, and we'll take a quick break after this. All right, so this is where the fun work begins. Because now when we are now talking about health, we have to figure out and kind of think about how do we cut the problem. So in community work, the issue is not to tackle the big issue of healthcare, because that's too big. Okay? We have to cut it. We have to specify it. We kind of think about that clearly. So I'm going to get some paper during the break. Okay? You guys take a break around 10 o'clock or so? Yeah. Okay, we could in a couple of minutes. So during the break, we're going to kind of replenish and get some paper out here for you. That's one of the first pieces. Okay? When you're concerned about health issues, how do you see health issues? And oh, by the way, we know almost nothing about the health issues for individuals, African American, Latino, or Arab, Chaldean, and Muslim under the age of 21. So in terms of the health issues of young people, it's avoidable. Okay? Aside from kids, cooties, babies, and HIV. But beyond that, we have no knowledge. We have no knowledge. So think about this. We're going to go over this quickly. We'll take a break, come back, and you can begin to write it. Because the first issue is we can't address the entire issue in our social action. We've got to get focused. So how do we think about this? And so I just have some questions up here, some thoughts on how to cut the pie that I've used in other programs and projects before. You're talking about access to health care. Okay? You're talking about is it available? Okay? For young people, for older. I mean, there's a real age barrier with some kind of healthcare access. Okay, you got to have mom's permission, but what if you can't get your parents' permission, or what if it's a sensitive issue and you don't want to get that permission? Okay, is it available? Is that the issue you want to change? Is it affordable? Are you really interested in healthcare prevention? Okay, for children and youth, seniors, adults. For working poor, is safety a public health issue? I would say yeah. Is handgun violence a health issue? I would say yeah, and it has been in the past. Healthcare. I was looking at federal programs. Do we need more information about the Affordable Health Care Act, misnomer, Medicare, Medicaid, SSA disability, Social Security disability, or state programs? It's just you need to think about what aspect of health care do you want to identify and do you want to make change in as far as your community or neighborhood is concerned? All right? So I know it's complicated, and when it can be complicated, it's going to break it down and cut it into something that's manageable, something that's doable, and something you want to do. So we'll take a 5-minute stretch break. Okay? I will work with